Good morning, everyone. We're Group 2 in Science. We're gonna present a topic about the common cold. Shall we start? Our today's topic is the common cold.
The common cold is a viral infection that affects the upper respiratory tract. It primarily affects the nose but can also affect the throat, the sinuses, and the larynx. The common cold and influenza are both respiratory illnesses, but the two conditions are caused by different viruses. Affected by colds have symptoms that are similar to people suffering from influenza, but influenza symptoms are more severe and can lead to serious health conditions such as pneumonia and even hospitalization. While cold symptoms can only last for a few days or weeks, the common cold is the most frequently occurring infectious disease in the world, affecting us humans. An average adult is infected 2 to 3 times per year, while an average child may get 6 to 8 times per year, depending on their age and exposure. The common cold is prevalent during the fall, the winter, and the spring.
Causes. Over 200 cold viruses exist, but the most common that is thought to be responsible for at least 50% of colds is the rhinovirus. The virus enters the body through the mouth, eyes, or nose and is spread by hand-to-hand contact. This usually happens when an infected person blows or touches their nose and then touches a person or an object.
A healthy individual who is exposed to this infected secretion either by direct contact or by touching a contaminated object often becomes infected after they touch their own nose, mouth, or eyes. The virus can also spread through droplets in the air after an infected individual sneeze, cough, or talk.
Symptoms. It usually occurs after 1 to 3 days of being exposed to a cold virus. These signs and symptoms may vary from person to person. Include sore throat, cough, sneezing, runny or stuffy nose, loss of smell or taste, low-grade fever, chest discomfort, difficulty breathing, fatigue or tiredness, body aches, chills, and headache, draining into the back of the throat from the nose, hoarse voice.
Diagnosis. A doctor can diagnose the common cold based on your signs and symptoms and finding during a physical exam.
If there are concerns about another underlying medical condition, such as bacterial infection, your doctor may order an X-ray or other test treatment. Treatment. No cure exists for the common cold. The common cold will resolve with time on its own and expectant management. Home remedies and medical treatment are directed at relieving the symptoms associated with the common cold. Home remedies for the common cold in older children and adults may include getting rest, taking a lot of fluids, using saline nasal drops to help relieve nasal congestion, and warm salt water gargle may be beneficial to people with a sore throat.
In infants and small children, home remedies may include getting rest, taking plenty of fluids, saline nasal drops, and bulb suctioning may be used in clearing mucus from the nasal passage. This procedure involves applying a saline drop and then gently suctioning the nostril with a bulb syringe inserted about 1/2 or 1/4 inch. Medical treatment may include pain relievers for fever, sore throat, and headache acetaminophen as in Tylenol and others. And ibuprofen like Advil may help with such symptoms. Adults can use decongestant nasal sprays, but children younger than 6 are not recommended to use decongestant nasal spray.
Thank you for listening and watching to our presentation. We hope you learned something from us.